I'll give you phosphatidylserine. That's the main supplement that I use. It is a supplement. It's not a prescription. It's basically a part of the cell membrane that they found was it kind of binds cortisol and reduces cortisol. So that's one thing that I use. Other people use rhodiola and some of these other supplements. You can get them online. You can get them through your GNC or your vitamin shop. Yeah, and they're very good ways to do it. Bring it down. We offer it at our clinic as well. Okay. The other thing that we do is if your cortisol is too low, because we have to deal with that too, because you won't respond to stress correctly, and that might harm you. So we also add what we call adrenal or Cortef. That's what they call it.
Okay.
It's basically a hydrocortisone. That is actually a prescription. Okay. And there's plenty of studies that show that levels between 5 and 10 milligrams twice a day, if you do it for a month or two, actually improve your cortisol level, but doesn't cause any problems physically. Okay. Now, if you go higher than 10 milligrams, you have to be careful and might have to taper people off. I don't use cortisol or Cortef more than a couple of months because you don't want to keep people on it. Now, there's a small group of patients that need it. And I have one patient right now that he has to take 5 milligrams twice a day. If I take him off, he's just going to feel like crap. So there's a small group of people that you have to continue it in. I mean, that's part of it is probably what the previous doctor did to him, because he had on a high dose of cortisol for a long period of time. And then you're trying to get him off, his body's gotten used to it. So you got to give him a little bit, okay? That's a rare case. For the most part, we can get that cortisol back up, and usually people in about 1 to 2 months, they're good, okay?
Okay.
Now, the other thing I do is we have a supplement called adrenal cortex support, and what that is a way to kind of help heal these glands, because these glands they can get burned out and go into what they call adrenal fatigue syndrome. I know there's probably some doctors seeing this right now, rolling their eyes. There's no such thing as adrenal fatigue. Well, I've seen it, and I've seen studies on it, and I know that people can suffer from where the adrenal fatigue is when your cortisol is chronically down. Okay, they can't get it up. Okay, and so what we try to do is help kind of boost those glands to see if we can heal them to get them back to where they need to be. If you're chronically pounding these glands and they're exceeding cortisol because of stress, you're going to burn them out eventually. So what we need to do is kind of get that cortisol where it needs to be. Okay.
Wow, this is so refreshing to hear about the cortisol. Yeah. We don't hear people talking about this much.
They don't. It's part of the stress issue. There's a lot of other things that are factors within stress, but this is the one that I can try to get control of and help people with. Obviously, another way to get rid of stress is get rid of what is stressing you, and a lot of people don't realize that sometimes it may be better to cut and run, because your health is really in the balance if you're under a lot of stress with what you do. I'll give you an example. I had a patient today come in, and she just switched her job from being a contractor to actually working for the company she's working at. She says her stress has gone down completely because you don't have to worry about being a contractor. That helped me. Now, some people don't have that aspect, or that they don't have that option to go actually do that, but it's something that will help me. That's the part that they can help me with, try to remove that stress in their life. Again, there's people's jobs, they have stress and they have to strive on it, but what I can do is try to mitigate these factors as best as I can. So.
It's like a 50-50 relationship.
Yeah. Oh, yeah.
They've got to help, too.
If a patient doesn't do their part, like I have a lot of patients that come in, it's just a very quick example. If you're not going to exercise and diet, I need you to do that to help make the hormones. I can't have you come in and say, oh, no, I'm not going to exercise, I'm not going to diet, and then come back and tell me it's not working. Well, it's because you got to do your part, too. I mean, I'm just going to give you the substrates and the ability to get you up to here, and if you're not taking it, you're going to be down here, and no matter how much hormones I give you, we're not going to ever get you up to here. You have to do your part. So.